welcome to another edition of Health with Patricia. Today I'm at Sheep Health Care and Medical Center and I'll be speaking with Dr. Promise Sepuga. We're discussing hypertension in pregnancy. Please stay glued to your set and get this education. Hi, Doc. Welcome.
Thank you.
Thanks for giving us another time.
That's right. It's always a pleasure to be able to do this.
We're discussing hypertension in pregnancy. So I want us to start from the very low.
Yeah.
What is hypertension in pregnancy?
So that's a very important thing because hypertension tends to complicate a lot of pregnancies. And if it's not detected early and dealt with, then it results in other severe life-threatening complications. So basically, hypertension refers to a high blood pressure, right? So everybody's blood pressure we measure, we expect that the top one should not be up to 140 and the bottom one should not be up to 90, okay? So if you measure the blood pressure, we say it's 140 over 90 and above, that is hypertension. If it's below that, then it's normal. So if that happens in pregnancy, then we say this pregnancy is being complicated by high blood pressure or hypertension.
I want to find out what actually causes it, and then secondly, is it like somebody who already has a history of
high blood pressure
without knowing, and then it's eventually surfaces in pregnancy? Or
right.
You can be without high blood pressure, but immediately you conceive, then it's setting.
Good. So both scenarios can play. There are some persons whose blood pressures are already high, but they are not aware. They have not been diagnosed, okay? And so the only time they get to hospital is when they got pregnant, and during the antenatal we realize that, your blood pressure is high. Others, so that is what we call pre-existing hypertension, okay, especially if we detect that during the first half of the pregnancy. You know, the pregnancy takes about 40 weeks. So if we detect that the blood pressure is high within the first 20 weeks of pregnancy, chances are that this woman was having a high blood pressure already before embarking on the pregnancy, right? And the other group may already be hypertensive and it's already known. She's been on medication, and then when she gets pregnant and it's still high blood pressure, that is also pre-existing hypertension. Okay. Another group would have very normal blood pressures prior to getting pregnant. And then in the course of the pregnancy, typically after the first 20 weeks, then the blood pressures begin to go up. That is what we call it used to be called pregnancy-induced hypertension, or now we say gestational hypertension.
I don't understand what actually causes that in pregnancy-induced hypertension. Because after you are okay, then after 20 weeks, is it that your system is not programmed well, or is your body itself
so it's just one of the complications that a pregnancy brings. So the whole of the pregnancy, the development of the placenta, something can go wrong which is not under the woman's control, and then the blood pressure happens. However, there are certain risk factors which would make this woman at risk or at a higher risk of developing pregnancy-related hypertension than another woman. And some of these are somebody who is older in age, or extremely 35 and beyond, or somebody who is very young. Somebody who has had a previous hypertension in her previous pregnancies could develop it again. Somebody who is obese could develop hypertension in pregnancy as well as diabetes in pregnancy. Somebody who has a family history of high blood pressure, when she gets pregnant, she stands a higher risk. Somebody who is carrying multiple pregnancy, so if it is single compared to twin, compared to triplets, the risk goes higher, right? And these are some of the reasons why somebody will have high blood pressure during the pregnancy. These are some of the risk factors.
Yeah. So is this something that can be controlled or cured, so that the person can just go through the normal pregnancy, or it has to be managed throughout the pregnancy?
Yes. So once we detect the high blood pressure, we need to look out for any potential complications that are related to high blood pressure during a pregnancy. Commonly, it affects the woman's kidneys. And if that happens, they start to leak protein in the urine. So we check the urine. Are we measuring protein in this woman's urine? If it shows positive, then it becomes high blood pressure, pregnancy, protein in the urine. That is called preeclampsia, right? But whilst doing that, we need to make sure the blood pressure readings are within normal range. So we use medications. Okay. Medications, there are various types of medications. Not all the high blood pressure medicines we use are safe during pregnancy. Okay. There are a few that are safe, and we use that to control the blood pressure, whilst monitoring and checking to see if this woman will develop the other complications of preeclampsia or kidney problems or liver problems, which may be as a result of the high blood pressure in the pregnancy.
I want to understand, how does it affect the liver and the kidney, and how the protein is coming from the baby, right?
No. Okay, so the high blood pressure means that the blood is flowing under a lot of pressure.
Why?
Because the blood vessels have become a little tight.
Because of the pregnancy.
Because of the pregnancy. Okay? And so as a result, the blood flow to the kidney gets disturbed. And that affects the way the kidney functions. So the kidney is not able to sieve all the protein before urine comes from the kidney. So the urine comes with some protein in it as a result of the high blood pressure affecting the kidneys. Okay. Similarly, it makes the liver a bit swollen, and then the enzymes that the liver produces, some will be leaking in the blood. And so when we check the blood level of the liver enzymes, they are running higher. And the same thing affects the placenta. So the placenta is the organ that forms between the mother and the baby. And so the placenta allows blood, oxygen, and nutrients to pass on from the mother to the baby. And high blood pressure affects how effective the placenta functions. And as a result, the baby may be, let's say, stunted. The baby doesn't grow as well as it should inside. And the placenta doesn't get to produce as much of the fluid that it's supposed to produce to take care of the baby, to cushion the baby. And that's how the blood pressure can affect the woman herself, the placenta, and then the baby. Now, if the high blood pressure is not controlled, it can rapidly develop into preeclampsia. If that is not managed well, with a lot of attention, close monitoring, the woman goes on to develop eclampsia, meaning the woman is pregnant, her blood pressure is high, there is protein in the urine, most likely, and then she develops convulsion, and then it becomes nearly fatal.
High blood pressure, preeclampsia setting, eclampsia setting.
Eclampsia.
So with this, how it all starts from 20 weeks?
Yes, most of it, if the woman was not already hypertensive.
Okay.
Yeah. If she's already hypertensive, then the hypertension is there before the pregnancy. Then it becomes complicated with the preeclampsia. And if not managed properly, eclampsia is a potential complication.
But I know that when hypertension sets in, you're on medication. Is it that the medication cannot manage or help you to stop every preeclampsia or every protein from getting into the urine? Yeah.
So the medications are supposed to control the blood pressure and therefore minimize the risk of the patient developing the complications. But sometimes they're on the medication all right and they still develop the preeclampsia. So the whole point is that once you're pregnant, antenatal care is extremely important. Once we have found out your blood pressure is high and we put you on medication, it is crucial to take it religiously and follow your antenatal schedules. Because each time the pregnant woman comes, we check the blood pressure, we check the urine. That's how we're able to tell that, okay, blood pressure control is good, or no, it's not too good. Let's add on to the medication, or let's adjust the dose of the medication. All in attempt to keep you safe so that you don't develop the preeclampsia. Sometimes you do all this, a few of them will still go ahead and develop preeclampsia. Preeclampsia can be mild, it can be severe. So we always want to prevent the worst of the complications by managing it so it doesn't get there. A few of them will still get there to the severe stages. If it's severe and we think it is likely to lead on to eclampsia, then we need to consider ending the pregnancy.
Ending the pregnancy with a surgery or induced labor?
Yeah, either of them.
If the blood pressure is high inducing labor, wouldn't it worsen the case?
Not necessarily. So you weigh the risk of trying to achieve vaginal delivery versus cesarean delivery. Which one can happen faster within safer duration of time? And then we choose that. Of course, if the woman has had a previous cesarean, maybe 1 or 2 previous cesareans where we cannot induce, then it's a straightforward repeat cesarean to end the pregnancy. Or if she's had a previous surgery like myomectomy we do for fibroids, that woman cannot undergo induction. She would have to be delivered through cesarean section.
So is it possible that at 20 weeks of hypertension setting in, is it possible that that same week eclampsia can set in and you have to end the pregnancy?
Yes, sometimes it can happen at any stage. Once we see that it is severe preeclampsia, we need to choose between what is the safest for the mother at that time. If the pregnancy has to end, irrespective of the number of weeks, it's the mother's survival which becomes paramount.
Not a baby.
Not the baby necessarily. If the pregnancy is gone past 28 weeks, the baby stands a greater chance of surviving. Below 28 weeks, not so great, but you can't say you are waiting for the baby to get to 28 weeks when the mother's life is at great risk. In that case, we need to end the pregnancy in order to safeguard the mother's life and well-being.
So does when you end the pregnancy, how long does it take for the blood pressure to normalize? Or it's so far as it's came during pregnancy-induced hypertension, is it possible that after birth it will continue?
So majority of them, after delivery of the baby and the placenta comes out, the blood pressure goes back to normal, especially if it came on during the pregnancy. A few of them, it persists and becomes a lifelong condition, but majority within 6 weeks to at most 3 months after delivery, the blood pressures will stabilize and become normal.
I heard something, I stand to be corrected. I'm told that mostly when the placenta is out, I hear the placenta is a contributing factor
True.
To the blood pressure. So
to the development of the blood pressure,
yeah. So immediately it's out, everything goes back to normal.
In majority of cases. A few of them, the blood pressures persist and the woman becomes hypertensive for the rest of their lives. But in a great majority, once the placenta is out, the blood pressures stabilize with time and they go off the blood pressure medications.
Is it possible that it will repeat itself in the next pregnancy?
There's always some theoretical possibility. It's not that it will surely happen, but if the woman has had hypertension in this pregnancy, she gets pregnant again, we're on a higher alert just to see is it going to happen again or not, because she stands a greater chance than the woman who has not had high blood pressure in her previous pregnancy.
Okay, so I want to find out, is it possible, is there something that can be done so that it doesn't even repeat itself, you don't even have 1% of it in the next pregnancy?
We can only do as much. Try to control your weight and then allow some time before you conceive again.
What some time is?
We normally say at least 1 year. And then once you get pregnant, report early so that whatever we can initiate you on to minimize the risk of it recurring can be started in good time.
Finally, is it every hypertension in pregnancy that affects the organs?
Yes, once the blood pressure is high during pregnancy, there's a likelihood that it would affect the kidneys, the liver, the placenta, the baby. And so we have every reason to control the blood pressure.
Thank you very much, Doc. So it has been held with Patricia, and my name is Patricia Roxanne Hammond. My guest as Dr. Promise Sepulga is a consultant obstetrician gynecologist with Sheep Healthcare and Medical Center. He's also a senior lecturer at the University of Ghana Medical School. Until same time, stay blessed.